My name is Gigi Arena, and I live in Palm Coast, Florida. I first realized that something wasn't right. I noticed when I would bend down to pet my big black lab, I didn't have to bend down too far, I would get winded. And that struck me odd because I was usually pretty active. At that point, I said, well, something's not right, and I decided and made an appointment with the cardiologist to have myself checked out. First, he gave me an initial test, and that was an echocardiogram, and said at that time that he believed I had a bicuspid aortic valve. He suggested I can continue to live the lifestyle I was living, and that I must follow up with a cardiologist every year. Fast forward about 12 to 15 years, we did a test, another echo, and it indicated that I was actually at a critical state. I went to see a cardiac thoracic surgeon that was recommended by my cardiologist, and it was a local doctor, and I was happy about that. I had heard good things about his practice. When I went to see Dr. Holt, my first thing was I went in there gangbusters about, I do not want a mechanical valve. I explained to him that I was adamant about that. I wanted a tissue valve, and my reason being, I did not want to be on a Coumadin regimen. I did not want to take Coumadin at all. That was my biggest fear. So I gave Dr. Holt a little run for his money, obviously, when I went in there, because he knew, of course, better than I did. He was looking at my size, and he was also looking at my age and my quality of life that I have now. And he suggested that I not dismiss a mechanical valve, and he gave me a couple of reasons. Number one, the biggest is the tissue valve. With my size, being a small, petite woman, my valve is small to begin with, and would obviously, the stenosis with tissue valve would actually come back. And he said maybe in 10 years it'll come back, and you'll have to have that surgery done 10, 12 years, and it's pretty extensive surgery. And he also said that I find I don't do a lot of these mechanical valves because people like yourself shy away from having to take Coumadin. He said, but from his point of view, as far as for the patient, it's, the longevity that you get out of a mechanical valve is a lot longer than a tissue valve. I was scared of Coumadin. I had heard, I know it's a blood thinner, and that's in itself, do I really want to thin my blood out? What's that going to do to me as far as my capability of my ability to live a full life? I like to exercise, I like to dance, I like to work in the kitchen with knives, so I was a little scared of it. But Dr. Holt suggested, because he was really looking out for me. He was concerned about having to do the surgery again, and he suggested that there was he and his colleagues had been discussing just recently, called On-X, and I left his office with him saying to me, look, here's the name of the company, why don't you go and research it? I left the office, my husband and I was very upset, but I thought, okay, I'm going to do my research. And that led me to doing a lot of research. I chose the On-X Aortic Valve because I felt that would be the best decision for me. I went on their website, I looked at everything that I could, I tried to understand the differences. I also went on other websites for other mechanical valves, and I tried to compare the two or the three. And in all the other cases, there was, I could see that the On-X valve was FDA approved for a lower dosage of blood thinner. Again, this was a frightening thing for me, to have to take this blood thinner. As I read the patients' stories, I realized that a lot of them had chosen the mechanical valve, and a lot of them were, of course, they had to be on a Coumadin regimen. Many of them, in fact, all of them, said they didn't have any problems with it. They dealt with it. Some were very active, athletic. They continued on with their lifestyle, and they didn't have any extreme bleeding issues. I was pretty impressed with that. I also thought, well, I'm kind of like, I need to talk to somebody at that company. And actually, I didn't think that was going to happen. I figured, here I am calling a company that makes these things. Why are they going to talk to me? Well, I took a chance, dialed the phone number. When I was able to speak to someone at CryoLife, I was so impressed with a company that has people, employees, working for them that actually understood how serious this was for the patient. And I thought, okay, I made up my mind. I'm going to go with the On-X. And then I had to make the phone call and let Dr. Holt know that I was ready for the On-X valve. I had my surgery for my aortic valve replacement on June 7th of this year. When you leave the hospital, you put on the Coumadin immediately, though. I was told that by Dr. Holt, with the On-X valve, that for the first 3 months, immediately after surgery, that I would have to maintain a certain level, and that after that 3 months, that level could practically be cut in half. So I was overjoyed about that. And I'm at my fifth month now, and about a month and a half ago, Dr. Holt contacted me and said, hey, Gigi, we can lower that level now. So I was overjoyed. And so we lowered the dosage, and it took about three weeks to actually get in that range, because you're dropping down now. So it's a little tricky, I have to say, taking the Coumadin, getting that sweet spot as far as the level that you want to be at. It's a little tricky, and don't be discouraged, because it'll work out. So right now I'm maintaining about 1.8, and Dr. Holt and my cardiologist are happy with that level. Being on a regimen of a blood thinner has not had any effect whatsoever on my life, my lifestyle, my activity, nothing. I take the pill at night, and that's it. I don't feel any different inside as far as having thinner blood. Taking a blood thinner with the On-X valve is not a big deal at all, and it doesn't slow me down a bit. I have 3 dogs. I started getting back into working my cardio by walking them. And I could walk pretty fast and without feeling winded, so I'm happy with that. But now I'm also on a quest to find a place where I can go and do, you asked me my passion. My passion is writing, but my second passion is dancing. That I want to really start up again, and that's what I'm going to wind up doing. I cannot tell you how great I feel about the fact that I have a valve that is going to, the On-X valve, that's going to outlast a tissue valve, which I wanted in the first place. But after being educated on the fact, I am so happy I did not go with a tissue valve. And my levels now are just a little bit above normal, in which was before I took Coumadin. So it's fantastic. It's like I don't think I ever thought that there was an option like that, and I'm so happy that I found it. With the On-X valve, having the lower dose therapy kind of like gave me a confidence that I could go out and do what I wanted to do physically. I wasn't going to be at a level where I would have to be afraid of scraping myself or hurting myself. So it's just opened up there's no hindrance, and I'm happy about that.